Hey everyone, today we're going to be talking about getting better sleep. Specifically, we're going to be talking about using light therapy to help sleep and depression. So first things first, I have no financial ties to anything that we talk about today. And before you get started using any of these therapies, please ask your doctor about it, as this is not recommended as specific advice for any particular person. So what is light therapy? So it's the use of special lights for the treatment of depression and sleep. It can be used on its own or alongside other treatments. And the types of lights used include things like these bright light therapy boxes and dawn simulators. So most people who are aware of light boxes know that they can be used for the treatment of winter depression called seasonal affective disorder. But there's also evidence that can be helpful for major depression, unipolar depression, and bipolar depression. And for sleep, there are different kinds of sleep-wake patterns that light therapy can help with to help with sleep. And it can also just reduce morning grogginess, which some people like using it for. The advantages of light therapy is that there's evidence supporting that it can be helpful, and it's generally well tolerated with minimal or no side effects. And these lights do not emit significant amounts of UV light. The disadvantages is that they do have some side effects, which are generally mild and well tolerated, but can include jitteriness, headache, nausea, irritability. Of particular note, for patients with bipolar disorder, there is a small chance of the treatment triggering a manic episode, and using it at a particular time of the day, 12 to 2 p.m., seems to decrease that. The light boxes typically are not covered by insurance, although they are a one-time purchase and don't need to be reordered monthly like medications. And it's not as well studied as some other treatments. How do you actually use light therapy? So we'll take a look at that for depression and sleep. So bright light therapy boxes. So the light is directed towards the face. As you can see in the bottom right image, the light is distinctly shining on their face. However, you don't need to look directly at the light. As you can see in the bottom left, you can use a computer. Some people like to read their newspapers. The boxes are pretty bright. They'll emit 10,000 lux, which is generally what's recommended. And moving on, so if you want to start using it for treating depression, one way to begin is with 15 minutes of bright light therapy in the morning, or 12 to 2 p.m. for bipolar depression. And 15 minutes also assumes you're using a 10,000 lux box, and you may need more time in front of the box for the same effect otherwise. And every 2 weeks, if you're not getting adequate effect, you can increase it by 15 minutes per day up to a total of 60 minutes per day. And dawn simulators are another kind of light therapy box. So if you take a look at the left, you can see that it'll start out pretty dim, and then it'll get brighter and brighter prior to the time you set it to wake you up. So, and that's usually 30 to 60 minutes before you wake up. And one advantage to these is that they're just so easy to set up and use. You place it beside your bed, you set it like an alarm clock, and it just goes. And one thing to note is that it's mainly studied for seasonal depression and hasn't really been studied that well for unipolar major depression or bipolar depression. Now let's talk about using it for sleep. And how does that even work? So when your eyes detect light, that sends a signal to a part of the brain that helps regulate the body's clock. It's what we call the circadian rhythm. And after that part of the brain gets this signal, the brain thinks that it's daytime and helps us to get awake and stay awake. And light therapy takes advantage of this and helps to regulate the body's cycle. So for example, if the body clock is set too late, it's harder to fall asleep at night because your body thinks it's still bright outside. It's supposed to be awake, and it's harder to wake up in the morning because your body thinks it's still time to sleep. And exposure to light in the morning, such as with bright light therapy or a dawn simulator, helps tell your body when it's supposed to be awake. And setting that can also help it know when to get to sleep. To help with that, you can also make sure you decrease your exposure to light at night before bedtime. And that's why they recommend not using devices at bright settings near bedtime. So it's also been used to look at changes, to help people with changes in their work shifts, changes in time zones when traveling. So in summary, light therapy is an intervention which is safe, it's relatively inexpensive, and it can be helpful for the treatment of depression and some sleep problems. Hope you found that helpful, and if you have any other questions, please reach out to your physician. All right, hope you have a nice day.